All right. Hey, everyone. Welcome to Empathy by Design. But today, this is actually a pre-conference live as we set up for Systems and Signals, which is our summit we're doing starting on Wednesday. So you can still sign up. We're going to be talking about how do we set up systems based off of trust infrastructure and how we can build systems of trust, equity, and responsiveness in a world that kind of just wants optimization and quick fixes. So that's what we're talking about today with Dr. French, and it's what we'll be talking about June 4th and 3rd and 4th as we explore from the angle of HR, tech, wellness, mental health, all these ways where we can build systems that are meant to be responsive to the human our human nervous system. But today we have Dr. French. She's going to be talking to us a little bit about how she works with digital health in her pediatric practice. First, Dr. French, why don't you talk a little bit more about your work as a pediatrician and kind of what it looks like from your angle on setting up what we call trust infrastructure in that world.
Sure. Thank you for having me on this summit. What an amazing, it's a wonderful, wonderful opportunity. And I'm so grateful also to be part of Integrate. What a wonderful community and everything that we've done over the last 10 years. I mean, it's just been fantastic to see the growth and to be part of it and to feel the growth within myself, right? My own nervous system regulation over the last 10 years. Wow, we've come so far.
Yeah, we have.
Oh my goodness, yeah. And so I'm thinking about, where I work. I work at DePaul Health Center for Cardinal Glennon Children's Hospital, and we have a integrative medicine, integrative pediatrics office there. And we provide care to patients for primary pediatric care. We also have a sort of a niche practice where we provide a holistic integrative approach to children who have complex chronic medical needs. And, I think after the COVID pandemic, we've just seen a huge uptick in chronic illness in children, mental, physical, and spiritual. And that's kind of where we offer care. And I have a wonderful team that helps me there at the office. And I'm very grateful to Cardinal Glennon Children's Hospital also for seeing the value with integrative medicine, integrative psychiatry, integrative nutrition, all the things that we offer there. So that's our kind of where I've been in practice 30 years, and I've been with Cardinal Glennon Children's Hospital for 25 years. And I'm hoping we can continue to do the good work that we're doing there for hopefully the next 25 years. But I was, I think I always think about the way, healthcare has morphed, in the last 30 years that I've been in it. And I think most of these healthcare systems, we unintentionally create stress for the people that we're trying to support, right? So, I think there's just intrinsically in healthcare, there's this chronic threat state. It's just everything is so urgent and there's always a sense of overload. There's just constant context switching and then there's the concept of these administrative burdens that are on me as a practitioner, on the team, and then also even on our patients and their families. It can start from things like forms, something as simple as filling out a form, to something as complex as having to take, a traumatic history, right? And then we have so much fragmentation, right, within the healthcare system and also just within sort of the healthcare access system. And so I think of a family accessing care, somebody that we're trying to support, but then they have to coordinate between the healthcare providers, they have to coordinate between specialists, they have to coordinate between schools and therapists and insurance agencies and government programs. And so I think the concept of fragmentation also creates stress. And then, we are unfortunately in a scarcity driven design, right? So, I mean, healthcare systems are just so chronically underfunded. And so, with staffing shortages and just everything, people are just trying to get more out of less, And so, I think that system just operates looking at metrics more than relationships, looking at outcomes more than how are we building a care system that actually is relational. And then something that I call digital friction, because I think our systems are created, they assume a default user, somebody, who, when we think about patient portals and we think about automated phone trees and we think about apps, just apps that are used nowadays, there's just so much complication built into those sometimes. And we at our office, we serve a really diverse background of people, socioeconomically, literacy, culturally, and so sometimes I feel like the system unintentionally, there's mismatch between the users
Mhm.
that we're attracting into our practice. And so I think those are some of the areas, as we know, the body keeps score, right? And so people can, I think, perform for a while, but then after a while we start seeing this, as I talk about, this chronic threat state, just the sort of this ambiguity, and there's overload, and there's sort of the surveillance that's going on. So I think those are some of the places where, our intentions are really good,
Mhm.
because we want to offer good care and we want to offer care that supports the nervous system. But there are some intrinsic things built structurally into our systems that definitely challenge that notion. Yeah.
Absolutely, absolutely, and you bring up a good point about, like, friction is, lots of times the things that we see, is that people are usually, using the person that comes into your office, right, is usually just, like, seeking out care, seeking out, like, health related issues, and then they're given these, like, high-tech pieces that were probably built for people that were, like, probably, like, designed for the actual designer that, like, designed them and not for the actual person in the room. Really,
Right.
that's one of the biggest issues that I see when we start doing, like, systems auditing and accessibility is that it's usually built those systems are usually built for, like, this personified person that's not real, and it's, like, because 'cause they're not really tested with actual people. So, I mean, and I think but it makes a difference, and what you were talking about with was, like, that fragmentation of people that are, referring that you see because you get people you get clients from all kinds of practitioners.
Absolutely. Yeah, definitely. And it's just I think that's one of the wonderful things about integrative medicine is really stepping back and looking at the family unit as a whole unit and the child as a whole
Mm,
child, because there is a tendency to look at some of these situations through organ systems or disease systems instead of physiological systems. And that's where nervous system
mhm.
regulation becomes so important, not just about offering the care, but also the whole healing process that happens for us as a team and also for the child and the family as a unit.
Absolutely, and that kinda thinks about, human capacity is how when we start looking at, um, not having systems based off of what we call urgency or based off of, "Oh my gosh, I gotta make the change." Um, when when have you noticed that human capacity and regulation, I guess, when are those not when are where's been the friction point between, I guess, regulation versus urgency and performance? Does that make sense?
Yeah, and I think one thing that's changed for me a lot, over the last, I would say, last 10 years since I started doing integrative medicine is like, when I go into my office, I'm not really asking, like, my philosophy has changed at a deeper level. So I'm not asking how can I get the most out of my team, or how can I get the
Mhm,
most out of my patients, but I'm asking what conditions can I create that allows my team and the families that I serve to remain whole
mhm,
while participating in this process, this back and forth process. And I think there's this paradox within the healthcare system where we want to reduce suffering, but we unintentionally transfer this operational complexity onto the people that are serving in our teams and also the people that we are actually serving. And
mhm.
so the pace is urgent, the pace is constant, especially in our office. My goodness, we serve such complex chronically ill families and children. There's so much distrust of the establishment, there's so much gaslighting, there's so much effort that has been put in, and when they finally reach our door, that we're trying to look at a pace that's more adaptive than constant. And so we're also really trying to create a space that's safe. So safety is foundational, right? Safety and
Right.
trust is foundational.
Safety is
And
always
then yeah, and then having place where repair and recovery are more important than perfection.
Mhm.
So I think we know that can we create a space where people can sustain. So I'm talking about the team members, but and also when I talk, I'm always talking in two contexts. One is me and my team, and then one is
Right.
me and the family unit that I'm serving, right? So can we sustain, can we recover from stress more easily? Are the relationships within the team and me with my team, are we continuously nourishing them? Are they improving? Are we
Right.
creating space where people can retain like agency and dignity? Because, and then are we normalizing human variability within the system? So I
Mhm.
think the system has to be designed in a way where, you know, instead of designing it for the ideal user, we have to be able to accommodate. Like I think of my office as a microcosm, right? We have people with visible needs and people with invisible needs, right? And so how are we meeting both? Because I think we have patients with different abilities, disabilities. We have people, different caregivers, people with different levels of caregiving. We have families with different languages and cultural backgrounds. We have families with, oh my God, such a variety of trauma histories, right? And then we have fluctuating energies within the team members themselves and also with what comes through our door. And we have so much neurodiversity. And
Yeah.
so I think if are we creating kind of a team that's regulated, so that I think people who are regulated they just learn better, they heal better, they collaborate better, and
Mhm.
then we make less reactive decisions. So we're looking at a capacity centered system, right? How can we create capacity for a space where the team can show up and the patients and the families can show up, where we are really measuring outcomes not by the perfection of the task accomplished, but really about how can we
Mhm.
recover and repair from
Right.
the stress that has been experienced, because it's just a continuous cascade of events that are happening on a day-to-day basis within the team and within the team family interactions. So I think that's my philosophy has really changed, and that thing is like I'm not looking for outcomes as far as efficiency. I'm really looking at outcomes versus recovery, like relate. Yeah, how do you recover, how do you repair?
Yeah, and I think that that's the thing that I talk about a lot in like when I start doing onboarding for apps or any kind of health system is like the return is what you're looking at, is what you're talking about. The same thing is, do you come back? We just want to know, because I think that the do you come back is a important metric that like people don't realize, especially from a trauma informed lens, how
Absolutely.
meaningful that metric is. Because if you can get them to come back, you have a solid metric. Okay. And same with the hospital, same with anything. If they come back to your doctor after a period of time, I mean, that is like almost the only metric. I mean, it's not the only one, but that is like the most important metric that it's, you know, most overlooked.
Absolutely. Yeah. And, if we have a team, we have a team that, recovers, because if we have a situation in our office, and we have these often where, we have children with complex needs. We have a lot of children on the spectrum. We have a lot of children with mental health challenges. We have a lot of children with very, very chronically ill, debilitated. And, so reactivity is at a high level with the
Mhm.
family and with the team. And so we can't really expect it's not about having a smooth day without any bumps. It's about having a day that's bumpy, but then being able to just, okay, let's bounce back, let's recoup, let's repair, let's move on to the next. But doing that in a way that the nervous system stays regulated through that.
Mhm.
That's really that's the goal for me, at least in our office, is that that has really changed a lot over the years. you know
Yeah, absolutely. And I mean, that kind of comes back into, this concept of, like I said, tracking the experiences, how they come back, right? And I think that sorry about that. My my phone keeps going on. Turn on do not disturb. Sorry.
I
I
should
thought
probably do that on mine
I
too.
I thought I turned that off. That was Victoria. Hi, Victoria.
Wow, that's good timing.
I know. Victoria just was texting. So
The
anyway.
founders of Integrate, yeah.
Yeah. Um, so um anyway, so what I was saying is burnout is, I think when we start looking at how people can return, we can I think we can get a better understanding of what's coming back, and if they're coming back, how are they responding to their actual symptoms? Does that make sense? Like, you can
Yeah.
go deeper if they come back. You get more
Yeah.
interested.
I mean, I think about my own personal burnout story. My gosh, I mean, I was, 15 years into practice, I was really kind of done. I was so
Mhm,
tired. Um, and I was just bored a little bit with the revolving door of sickness. I was seeing, it felt like people were just sick and sick again and sick again. And then I was also myself really not in a great place, mind, body, spirit. And I know that I was functioning externally. Nobody would have known the amount of internal stress that I was undergoing. And I think our bodies register the strain, the nervous systems register the stress long before your performance is affected, right?
mhm,
And so I think that tracking regulation is really more important than tracking results. So for example, if we have a situation in our office where there is a stressful situation, whether it's with the family or with the team, I'm more interested in, like, not that we completed whatever we completed, but what did it cost us to do that, right? Like, so how much did we have to override? How much pain, panic, exhaustion? How are we recovering? And so we have in our office, we have what I call like low burden check-ins, repeated low burden
mhm,
check-ins. So we have the traffic light system, which I really love, which was
mhm,
given to us by the Care for the. There's a lovely program called the Care for the Caregiver program at Cardinal Glen Children's Hospital for everyone. And Holly Stroot, who was in charge of that, she's an amazing innovator in that area. She'd given this to all the offices, and it's a little traffic light system, green, yellow, and red. And so I think just the check-in, and every morning when we come in as a team, like, where are you? Like, how are you feeling? Do you have the capacity to show up for your team members today, or do you need to be held and supported? So, where are
mhm.
you, red or green? And then we have the huddles and the check-ins in the morning and at lunchtime, and we're doing mindful moments. I try to do mindful moments. We have a whole Zen cart back in our break room, but just maybe a card, drawing a card and reading it, or doing a little bit of stretching, or just check in with everybody. Where are we? We have a singing bowl, So I think the checking that, first of all, that we're doing okay, and then we're looking at a space. Again, safety is foundational. We've got to design healthcare systems and places that sort of allow physiological honesty, right? So people hide stress, because systems tend to punish vulnerability, like, or at least people are afraid that they're going to be punished if they show that they're vulnerable, or they show they're being
Mhm.
affected by the stress, right? So we have to have a space that, it's not a place where nobody ever gets stressed, right?
Right,
Because that's never going to happen, right? It's
right,
more about how do we have a space that allows for you to make a mistake and then recover and talk about it and then repair and move on.
right.
And then the other thing I think that's really important is the surveillance has to really become more of a collaborative,
Mhm.
where you're actually surveilling yourself. So becoming, I think that's where all the work we do with Integrate and within the app and within our workshops and, all of the stuff that
Mhm.
we do, that we are learning as individuals, right? To know where our nervous system is falling and how we're doing, but also being able to do that as a team. So everyone, you
Mhm.
check in with yourself, you check in with your team, and a model that's participatory is just healthier than one that feels like a big brother approach, that you're being monitored,
Right,
because that just, that again, it's just like people, it's just, again, it's just that the surveillance and the overload and the ambiguity and just this, again, what I call constant context switching,
yeah,
the body just doesn't know where to focus, there's just,
right.
it's so unregulated and you're so off balance. And so I think in our office, I think these check-ins, and then also just having that safe space to bounce back and to check on each other and recover as a team has become really, really important. Having
Mhm.
that physiological space to be stressed, to acknowledge, okay, I am stressed. It's okay. It's a normal nervous system reaction, but also I also have the empower myself the capacity to recover from that individually and also as a team. And then also, again, that sort of translates into the families, right? So if they come in, family comes in, most of the time they come in very stressed, very
Mhm.
anxious, not knowing expectations and agendas, and and just bringing in the trauma that they come in with them. As we know, everybody has a trauma history, right? That kind of influences everything. So I think just knowing that we have a safe space for to hold all of this, the capacity to hold all of this, really depends on our ability to be constantly checking in with our nervous systems and constantly self-regulating moment to moment, really, with all the tools that we've been given.
Yeah, and you're bringing up a good point that Jen Schneeman is going to be talking about in the Digital Health Summit. She's going to be talking about that very thing you just talked about not is not how do we build up a system where we can, you know, be not self-surveillance, but be embodied, but not outsource our sense of regulation to a piece of technology, which is just
Right.
so I mean, that could be a whole thing. You know what I mean? Because we have all these things. We have all these devices, these watches, rings, whatever, that
Yeah.
are
Yeah.
like tell us what we're, what we're doing. And, I'm currently in a nervous system based course right now, and I will have people in my group that get really upset when their felt experience doesn't add up to whatever the piece of technology is. And it's like,
Mhm.
well, there's perceived, I mean, on our app, we do data through perceived felt sense versus like biometric felt sense. You know what I mean?
Yeah, huge difference, right? Yeah,
Yeah,
like
it's not talked about very often.
yeah,
We should talk about that more in a digital health summit.
yeah, yeah. I think it's so important because there is such a it is, I think data is useful. I
Yeah,
think it has its value, but the problem is if it's the only metric that you're using to track your nervous system regulation, then I think it can be a disadvantage.
sure.
And and the thing is, people like shiny charts and colorful numbers, and people love it. People love feedback, right?
Yeah,
But you're right. You have to be careful not to outsource um, your the surveillance, because then you have to be able to. And I think we talk so much about vagal nerve work in our office, and it's of no value. I mean, people are always asking about vagal nerve stimulators and all the devices that are out there on the market, and I'm always really coming back to, like, how about we just kind of do some bio belly breathing or some humming, or things that are you're using your own body's vagal nerve response and your own body's GPS system, for lack of a better word,
right.
to guide you. And then, I think also having some of the outsourced stuff that can be helpful, especially with children with attention, trying to bring their attention to, I always joke about how apps and devices are the gateway drug to mindfulness. Like, we got
Mhm,
to start somewhere, and children, especially this generation, they're so tuned
mhm.
to to looking at a screen or looking at something outside of themselves for guidance. They're just so used to that. That's just their generation. So relearning that concept, sometimes you have to start off with apps and devices and things. But even within the integrate app, like the whole tiny signal
Yeah,
program, it's so fantastic because it, like you said, it's so somatic, right? It's appealing to your own body's innate inner wisdom, and it's guiding you through your own body's innate wisdom through an
right.
app. I think it's brilliant. Yeah.
Yeah, and I know it's like I think Robin, one of people integrate, she was like, "It's so funny how you're, like, prompting them for interoception, but, like, it's structured through an app." It was
Yeah,
like,
yeah, yeah. It feels paradoxical, but it
that's
but it
paradox.
works. Yeah.
But I mean, and by that note, I will say our the thing we're gonna be discussing over the next 2 months is holding complexity together, because that topic was so popular last summer. We got so much feedback from Sarah's DBT skills to kind
Fantastic.
of the nervous system pairing, that I was like, well, yeah, we'll do it again. We'll just do like 2 months of it, and because I think it's like right now, because we live in the world we're in, and I've written about this over the last couple of days. This goes into the paradox of technology. Well, because AI is like in there, but
Yes.
like I was like, you can only hold so much. Two things can be true at the same time. that's what we said last year. And I think my consciousness upgrade is, and only one of those things that can be actionable. You know what I mean? Because you can't
Mm,
hold so
mm,
much paradox
mm,
that it
mm.
override, because you're right, like you just can't philosophically or realistically do that. And I think that's the thing that, going back to the embodiment, is, and at the end of the day, you still have to go back to your own felt sense, your own sense of reality, your own sense of being in your body. I can hold multiple truths, perceived truths at the same time, and also know at the end of the day, I have to advocate for the things that are real inside of me, inside my body, my physical experience. And I think that that's really in true right now, especially with AI and artificial
Absolutely.
intelligence and all those things. It's a really important thing, which is why we're going to be spending 2 months on
That's
it.
fantastic. Yeah, love it. Love it. Yeah.
um, okay, so I think the other piece that we were talking about is also like, um, in what ways can providers and clinicians or teams, how can they use the nervous system to shape care outcomes? I think you kind of been talking about it the whole time, but in general, how do you use like what we know from polyvagal theory? What do we know
Yeah.
from all the somatic experiencing to help us shape those systems?
Yeah. And again, so this is something again that I just feel it's so interesting because, I've been in leadership roles most of my professional life,
Mhm.
um, team leaders for the team or site supervisors for the clinic or in professional capacities as far as teaching fellowship trainings or and I can feel how my own the process that I've been through has just changed so much after with integrate just being part of sort of a trauma informed community and understanding the concept of individual resilience versus structural resilience and things like that and what I've found in my office is that far more important than a formal policy or a clinical protocol is really like the nervous system of the practitioners and the team and the leaders that shapes that environment so much more because I've been many, many times in chronically dysregulated environments, and the problem is once an environment, a healthcare system or a healthcare team or a healthcare environment gets chronically dysregulated, then what happens is it doesn't matter how much resilience you try to build at the individual level, the system itself is generating this physiological overload. So it's
Right,
just, you know what I mean? Yeah. And so I think that it's important on a policy level to understand that nervous system health is not separate. It's not
right,
separate from operational quality. In fact, it directly influences the outcome, right?
right.
And so in our office, I think, what I've noticed is that I have to, again, this is why so much of the work that I do, I just having burned out once, I just don't want to burn out again, and it's just like a daily practice, moment to moment practice, because we know all trauma informed care is relational health right now, right? So all relational health is about co-regulation,
Yeah,
correct? So if I have to show up as a calm, grounded leader, because then the circumstances are coming at us, the stressful circumstances are not going to change. They're coming at us,
right.
that we are going to have those circumstances. Our office also creates that space where we see a little bit more intensity than I would say an average pediatric office. And
Mhm.
when you're stressed, your perception is really narrowed,
Narrowed.
and it really changes your moral experience. I mean, compassion fatigue is real, and I have experienced that myself, and it's really frightening when you don't have the capacity to feel the suffering of your fellow
Mhm.
patient
Yeah.
or your team member, right? And so what happens is, an anxious leader can just create organizational hypervigilance and, just everybody gets so stressed. Whereas a really emotionally stable team leader can really stabilize the whole the whole day. And so I think that these small changes make huge, huge differences. And so I always, my goal for my team at work and then for myself also is just, I think some of the basic sort of the tenets are, we need a safe space that we can acknowledge that we've made a mistake, we need a safe space where we can apologize without collapsing. I think that's really hard sometimes. It takes a lot to acknowledge that you made a mistake, and it takes a lot to apologize. And we can't do that unless our nervous systems are regulated individually and co-regulating as a team. So you have that safe space to do it, right?
Sure.
And then I think the other thing that is really important is for us to all remain present during times of difficult stress or conflict, and to be able to tolerate emotional intensity. Because as we all know in the trauma-informed world, that it can bring a lot of emotional intensity with it, and sometimes families and children, and sometimes us as individual team members, we don't really even know when our trauma histories are showing up.
Yeah.
Yeah, we don't know. And unless we can be aware of how they show up and how to regulate through it, we can't really tolerate. Like I said, the perception really narrows when we're under stress if we don't have the ability to regulate. And then again, it's that rebound that's so important, right? So how do we return to a sense of connecting with ourselves, first of all, finding that space. I always talk about the space of calm within the chaos, whatever it may be. I think for me personally, it's like I wash my hands twice for every patient. So I wash my hand as soon as I walk into the room, and then I wash my hand just before I leave the room. And those are kind of the times that I'm connecting with myself. I'm kind of washing off whatever has happened before coming into the room, so that I am present for the patient and also present for myself. And there's a beautiful meditative process where you can imagine, your hands as a lotus flower, and they're just opening under the water as you're washing them. So that's kind of where I go. And then after I'm done with that patient, I wash my hands again and again. I'm sort of again washing myself clean of whatever might have come up in that appointment, so that when I walk out to my team, I'm regulated and I'm ready to tell them what needs to be done without any kind of, overlay from what's happened. So everyone has a different way. So I think the return to connection after stress, hugely important. And then checking in with the team, if we've had like an incident, sometimes a parent can become belligerent, a child can become combative and aggressive. Somebody can be really, really unpleasant over the phone, and we hold space for all experiences. We understand how anxious and stressed families are, and all of the socioeconomic, social determinants of health, all the things that people are going through. And the world is a very chaotic, crazy, scary place right now, and but we have to be able to bounce back so that we are present for the next patient, we don't shortchange them, and also that we don't take it out on each other as a team, right? Like, we're going to have to co-regulate. So I think that it just becomes so much more important for me. I think over the years as a pediatrician, being a good pediatrician, I think, being able to help people get empowered and stay on their journeys of healing is really important. But I think addressing intergenerational resilience for the family unit, for my own family with my children, and also for our team members within their families, I think all of that has become so much more important too, just to really, really fight this huge, challenge of chronic inflammation and chronic disease that we're facing, on so many levels, mind, body, and spirit.
Absolutely, and I think I really like the exercise you talked about the breathing. I think that that's really good, and also just to promote it out there, if you go in the app, you can go to a playlist and you can listen to her mantra music, which is also a really great way to do it too.
Thank you. Yeah, thanks for the shout out.
I know. Can you talk I know you talk about this well. We can segue off of this. You didn't know this was coming. But I know you can do it on command. Can you talk a little bit about mantra and
Yeah,
kind of talking about the
absolutely.
playlist on the app you have?
Yeah, I love it. And it's so nice to have that out there on the app. The music came from a space of like trying to find a way to merge the East and the West for my own children. They were young at the time, 6 and 3. I wanted to teach them Vedic Sanskrit mantra, but I couldn't teach it to them the way my grandmother and my mother taught me. They weren't willing to take it that way. And so I had to bring in some English meanings, and then I kind of created this fusion music. And then with that, we just found a harmony within our family. There was so much healing going on between me and my children. And then I started putting it out to the community. it's on all the streaming platforms, and I offer it in the community in St. Louis in several yoga teacher training programs and workshops and things like that. Julie and I are going to do a workshop next week,
I know.
where we're going to
Yeah,
offer somatic work and mantra and art and all of it.
every
And
quarter.
I think it's such a powerful, the neuroscience behind mantra is fantastic, because I mean, my goodness, it really rewires it, the neuroplasticity, it rewires the brain, and the heart, the heart and the brain connection, the heart brain axis. And it also, it does, because you have to breathe in order to chant. You your vocal cords, nitric oxide, your breath work, your vagal nerve. And then the other thing that it does is, it's sound healing, because you're generating vibrational sound healing that, if you do that for a certain amount of time, and that's why the repetitive nature of mantra is so important, because you get to a point where you're reaching entrainment, where your vibrational frequencies are coming into alignment with the vibrational frequency of what you're creating. And that process takes away blocks of energy within your meridians. And we know from ancient, medicinal systems like Ayurveda and Chinese medicine that we have energy flowing through our body all the time. And we have an energy body. And if that energy body is healthy, then your physical body is healthy. So if you can keep it, so I think mantra has just so much value and so powerful, and they've done all those wonderful studies looking at how it increases gray matter, especially when we're talking about trauma-informed care, parts of the brain, the high, the hippocampus and the amygdala, and all the, the alert stress systems, the gray matter rebuilds beautifully. So just mantras, yeah, I love, and I'm doing some neuro research on it, hooking up my own brain, and just kind of looking at how my brain waves change, from all the chaos to the calm while we're chanting. So all of that's it's been fun.
It's super fun. You can go check those out in the app. And so Anu is also locally, we are doing the Somatic Art Lab as well, that with some people that have requested online. One day we'll get there. And we have done it online before.
Yeah.
We have done it online before. A couple of people, including Sarah, have requested it online at some point in time. But yeah, I know if you're in St. Louis, you can go check out our app and go check out. I think we have like 3 spaces left.
Yeah, it's filling up quickly.
Yeah, it's filling up. So we only have like 3 places left. It's Saturday from 4:30 to 5:45.
June 7th.
Yeah, June 7th. So go check it out. We're going to be doing the digital. We have our whole month is pretty much this week. Really putting all of our whole content out in the first week.
And then we can enjoy the summer.
That's why. So anyway, and then Tuesday and Thursday and Friday, we have the Digital Health Summit. You can go sign up for that. There's going to be a recording. We're going to be talking to people like Lucy Flores, Lydia. Oh man, I was like Lydia Brown's in St. Louis. Oh my gosh, Hopper. There we go. And Lydia Hopper, and we have Sarah and Katie Kurtz. And we're going to be talking about the same thing we just talked about here. How do we build systems that we can that are responsive to the human system, right? And what does that look like from all these lenses? So that's specifically from the technological trust infrastructure lens, which Katie specializes in. So
fantastic. Yeah.
Anyway, we'll be doing that this week. So come see us, whether in St. Louis or online. There's multiple opportunities. So thank you so much, Anu, for coming and hanging out with us. And we're so excited to keep talking.
Yeah, great. Yeah, it was this is fantastic. I think talking about this topic just reinforces for me the personal responsibility I have to take care of myself, my own nervous system, and then also the responsibility I have towards my team and my patients to just continuously, make do the work.
It really is. I was talking to a friend of mine this morning, and I said this whole system is always meta. It's like, wouldn't you know, the week that I have to talk about trust infrastructure, I'm like having to work with trust issues within myself. You know what I mean? It's like,
all healing is self-healing, right?
I know, it's always just a mirror. I'm like, it's always like, what are we doing today? I'm like, I will bet your bottom dollar something will show up on my doorstep where I'm working with the same issues with whatever we're putting out into the world.
Absolutely. And I think I see that in my office too. Like I always talk about like the holy encounter, right? Where the healing goes both ways for sure. Yeah, there's just no doubt about that. And I think over the years, understanding the importance of co-regulating with families and children, creating those spaces where they can feel safe and, feel like they're supported and feel like they're heard and seen and
Mhm.
affirmed. I feel
Yeah.
like, yeah, a place where they can just tell their story is the most important thing. I think beyond any kind of, course or fellowship, training, or anything else I could learn on an intellectual level. And I understand how important all of that is, but I think just, being able to sit on the ground, sit on the floor and look at a child and know that they feel safe and that they are co-regulating and that they can tell you their story and that they can feel empowered that they're going to get better. I think that's the most important thing beyond any of the blood work and the supplements and all of the other stuff, which, also comes along with it. But yeah, I think that's just the most important thing. So, because, people regulate through relationships, right?
Yeah.
So, I mean, I think, you can have a technically functional system, but it's not emotionally sustainable if
Oh,
you
yeah.
can't create a safe space and just really, I think predictability, removing uncertainty, all of that is really, really important. Yeah. And we have to really orient before we interrogate. That's what I always tell my staff. We have to orient, we have to create the safe space before we start asking the questions and doing the medical work. So
Yeah, absolutely, absolutely, absolutely. I'm right where with you. Well, thank you so much,
okay.
Manu. Always love
Take care,
having you.
Julie.
Thanks,
Thanks
everyone.
for having me on. Take care. Bye.
Absolutely. All right. Okay.